Hi, my name is Maria and I'm a senior pharmacist in the Rotunda Hospital. So vaccines are one way to prevent specific infections during pregnancy. Some vaccines are recommended before pregnancy to ensure that the mother has immunity against specific infections before she becomes pregnant. Other vaccines are recommended during pregnancy to protect the mother and the baby. The immunity also helps protect the baby during the first few months of life. Yes, before you become pregnant, you should ensure that you are immune to infection from rubella. You can check this with your GP. If you don't have immunity to rubella, you can get the MMR vaccination before you become pregnant. The MMR is a live vaccine and must be given at least 1 month before pregnancy. You may also check your immunity to varicella or chickenpox before you become pregnant. Most women have immunity. However, if you do not have immunity, you may get the varicella vaccine before pregnancy. Talk to your GP. You should avoid pregnancy for 1 month after receiving the varicella vaccine. You'll also be asked about your immunity to varicella in early pregnancy. Varicella vaccination is not recommended during pregnancy. Therefore, if you're pregnant and you do not have immunity, you should avoid people with chickenpox or shingles. If you're non-immune, you'll be offered the varicella vaccination after you have your baby. So chickenpox is caused by the herpes varicella zoster virus, and you can catch chickenpox by just being in the same room as someone with it, and it's also spread by touching things that have fluid from the blisters on them. Most people have immunity from chickenpox infection during childhood, so it's rare to get chickenpox when you're pregnant. If you do get chickenpox when you're pregnant, there's a small risk of your baby being very ill when it's born. If you are pregnant and you do not have immunity to chickenpox, it's important to contact your doctor or your maternity hospital as soon as you can, as you may need medicine to help you fight off the virus and stop it from causing harm to your unborn baby. There are a number of vaccinations recommended in pregnancy. Some of these vaccines are recommended later in pregnancy, including the whooping cough vaccination and the COVID-19 booster vaccination. These vaccines are recommended from 16 weeks of pregnancy. During flu season, which runs October to May, the flu vaccine is recommended in pregnancy. You can get the flu vaccine at any time in pregnancy, even in early pregnancy. The flu vaccine is inactive and can be given safely at any time during pregnancy. Getting the flu vaccine during pregnancy will help you and your baby in the womb. If you are vaccinated during pregnancy, your baby also benefits from protection for up to 6 months of life. So treatment of infection during pregnancy is important. If left untreated, infection can make you and your baby seriously unwell, so it's important to take antibiotics if they've been prescribed for you. You can also feel reassured that antibiotics are commonly used during pregnancy, and many have strong evidence for their safety in pregnancy. If you have an infection, your doctor can weigh up how necessary the medication is to your health against the possible risks to you or your baby, some of which will depend on how many weeks pregnant you are. Your doctor will only prescribe medications when absolutely necessary, and will be happy to talk to you about any concerns that you might have. So every pregnancy is unique. The advice that you're given as to whether to start an antibiotic may not be the same as the advice given to another pregnant woman, even if you're both taking the same antibiotic. A common antibiotic used in pregnancy is amoxicillin. It's part of the penicillin family. Numerous studies of penicillin antibiotics in pregnancy have found no evidence of risk to the developing baby and are considered safe. If you have an allergy to penicillin, there are alternative antibiotics that may be used in pregnancy, and that will be decided based on what type of infection you have. So you've just found out that you're pregnant and you're taking medication, so what should you do? Many women who are pregnant continue to take medication for a variety of medical conditions during pregnancy. If you're taking medicines for physical and mental health conditions and you find out that you're pregnant, you should talk to your GP or whoever prescribes that medication as soon as possible. By doing this, you and your doctor can make a plan about how best to manage your medication during and after your pregnancy. Many women will continue to take their medication during the pregnancy, but some may change or stop their medication. So it's very important that you don't just stop your medication suddenly unless your doctor tells you to. Your prescriber will make that decision and it'll be the right one for you.